Good afternoon, and thank you so much for the invitation. Uh, I'm new to the vaccinology world. My basically background is with infectious disease surveillance. I was in charge of dengue surveillance in Brazil for quite some time. And I was just thinking about James' presentations and mine. When we think about vaccines, usually the figure that comes to my mind is a smiling child. There aren't going to be smiles around here. We haven't seen any smiles with Ebola, and we're not going to see this with Zika. Uh, Basically, we are talking about two different tragedies with similar challenges. Well, I'm going to skip this because we all know that Zika virus was first identified in 1947 in Uganda. Uh, And Zika is quite different from dengue and chikungunya when you think about the disease itself. It's a mild disease. Uh, Hospitalizations and deaths are really rare. And it affects about 1 in 5 people infected, they develop symptoms. And it's transmitted by the Aedes aegypti, but also from person to person, as we have discovered more recently. And basically half of the world's population live in areas at risk for dengue, for Zika, for Aedes-borne diseases. And Zika is now identified in more than 70 countries and territories since 2007. But 67 countries since last year. So it's relatively new and spreading a lot. And when you think about the burden of this disease, Brazil represented at some point around 15% of the population exposed to the disease, but as the virus is spreading, this proportion is reducing, but we're still around 10% of the population exposed to the virus. And these are very different stories when you think about what happened with Ebola and what happened with Zika. The introduction of Zika was first identified by the end of 2014 with an outbreak of exanthematic disease in the northeast region of Brazil. But no hospitalizations, no deaths, not a big deal from the public health perspective. But things started to change by the end of the first semester in 2015. We were just out of the worst dengue year ever in Brazil, with more than 2 million reported cases in 2015. And from April on, in the northeast region of Brazil, and this is one of the similarities with Ebola, because this is the poorest area in the country. The Zika virus was isolated from the northeast in Bahia state. Some clusters of Guillain-Barré syndrome associated with the exanthematic disease were identified in Bahia and Pernambuco states. And early in the second semester, the first cases of microcephaly were identified in Pernambuco state. So up to August, Zika wasn't really a problem. We had outbreaks in the northeast, but nothing that was affecting our health system in a huge way. But a lot of things changed since then. So it was mentioned that by February this year, WHO has issued a warning for the world regarding Zika. But when that warning was issued, we had more than 4,000 suspected cases of microcephaly in Brazil at that time. So the virus was identified. We noticed some changes in the epidemiological pattern of microcephaly. We started the investigations by October. And right now, Zika is autochthonous in 22 of our 27 states in the country. But not only that, this year, in 2016, we had, again, almost 1.5 million dengue cases in the country, but a lot of these Zika cases, they were reported as dengue suspected cases. So we have a very well-established surveillance system for dengue for quite some time in the country, but not as good as a surveillance system for Zika. So we believe that a lot of the cases are reported as dengue so far. And who's being affected by Zika in the country? Basically, young adults from 20 to 29 years of age, also reproductive age. And this is a pattern very similar to dengue so far. Okay, so this is the worst of Zika, the malformations related to an infection during pregnancy, especially microcephaly. Well, up to 2014, we had basically around 150 cases of microcephaly in the country. But when we take into account 2015, 2016, for all the suspected cases, there were more than 10,000 cases reported throughout the country. Brazil is a very, very large country, and it's spread in a huge number of municipalities, as I'm going to mention in a couple of minutes. We still have 3,000 cases under investigation. Fortunately, half of those cases were discarded as microcephaly and associated with Zika, but we have more than 2,200 cases of microcephaly or other malformations. And this is very dramatic because these children, they are basically a case of anencephaly. And these presentations like the Ebola one, or to talk about Zika, they are very hard for us who have experienced these scenarios. And I was somewhat very, very naive when I asked one of the leading neurologists in attending the cases in the Northeast a couple of months ago. Okay, new cases, they have reduced. So it seems to me that you're living in a better time now. And she said, no, it's much worse than before because now these children, they're dying. So far, we have around 400 deaths among those children. 185 were confirmed cases, deaths associated with Zika, and we still have more than 200 cases under investigation. Well, and as I mentioned, Zika was a problem mainly in the poorest area of Brazil, in the northeast of the country. And right now, what I try to do is I try to put together some data for you so you can bring it with you. If you're not a Portuguese speaker, it's a little harder for you to get access to this data, but it's available on regular bulletins from the Ministry of Health. But we have reported cases in more than 1,700 different municipalities. We have confirmed cases in more than 700 municipalities. And basically, these suspected cases, they represent 31% of the total municipalities in the country. Think about it, the amount of cases spread throughout the country. Okay, it didn't have a great impact in our health structure. We have very well-established prenatal care throughout the country. We have one of the most amazing immunization programs in developing countries, but it wasn't directly affected by it. But the social consequences for Zika, this is a new scenario for us. Well, this is my million-dollar question for the moment. When you look at the amount of cases report of microcephaly or malformations reported by the different regions of the country, you're going to see in red the northeast of Brazil, and you're going to see the rest of the regions with much lower cases, number of cases. Well, and we have had thousands of Zika cases this year in central Brazil, which is in the orange line here. And so far, I had two main questions for the second semester. will there be a second wave of microcephaly in the Northeast? And is there going to be waves of microcephaly in central Brazil, in the southeast of Brazil? And the answer so far is no. We have cases, but we have very few cases compared to what happened in the northeast of the country. And there have been some discussions on this. Okay, the Northeast, they're basically an area free of yellow fever, and vaccine coverage for yellow fever is really low. And it's really high in central and north of Brazil and parts of the Southeast. And someone has suggested that there may be an interaction with the yellow fever vaccine. Personally, this isn't my first option to explain it. But when you think about dengue, and I'm going to talk a little more about dengue tomorrow, central Brazil and part of the southeast had incredibly huge outbreaks in the past 3-5 years, and not in the northeast of Brazil. They have dengue historically, but not a lot of cases recent. What if these recent dengue antibodies play some role in the interaction with the Zika virus? Since we are learning that some epitopes of the virus, they are basically the same. So we still need a lot of new knowledge from this. Well, the impact on the health system was not as large, not closely, as what happened to Ebola. But the number of cases increasing throughout time, and especially, as I mentioned, in blue here, which is the northeast of Brazil, led to a huge pressure from the society for the government to improve the vector control activities, trying to reduce the number of cases around, and also for the surveillance system. Right now, basically all the states, they have committees to evaluate each of the suspected cases of microcephaly. And over time, you can see that initially most of the cases, they were under investigation. And right now, we have a lot of those cases that were discarded. Basically, 70% of the cases were already investigated, most of them discarded, but a lot of those cases were confirmed. Well, another concern for this year it was related to the Olympic Games. Matthew asked me something about it. And we were not concerned about it in Brazil because we have a very marked dengue season, and similarly for chikungunya and for Zika. And fortunately, nothing happened in special for this period. But as you know, Brazil is facing a huge economical crisis right now, one of the largest crises in our history. And the emergency of Zika led to new investments from the government. Basically, $200 million were invested in the first stage of the epidemics. It was late October, November, January, as a preparation for the new dengue season that usually starts by December. At that point, a huge effort was made to visit more than 48 million households, more than 260,000 community health agents were daily involved in activities to reduce the breeding sites and reduce the number of vectors around. Additionally, the group from vector control and mobilization days were also conducted, including military men and regularly acting military men with this. And by February 19th, there was this huge social mobilization, including students, teachers, officials, and other people from schools, universities, and other organizations throughout the country. It was estimated that 60 million people were involved in these activities to prevent Zika during the 2016 period. But I'm just about to finish, but I need to make the most important comments and one of the most important lessons at this point. Okay, you have seen rumors with Ebola, and we have a lot of rumors with Zika. And we need to learn how to address these rumors in real time. One day, it was a rubella vaccine that was causing this. Okay, so it's putting vaccines in jeopardy. Okay, next day, it was larvicides, insecticides that were being used around. And new rumors. They were being created weekly, changing the focus on what was the most important thing at that point. That was to prevent new infections in pregnant women. So right now in the country, we had several ongoing cohorts with confirmed pregnant women with Zika. They are being followed since the first semester of this year. So far, we haven't seen nothing like what happened in the northeast of the country, fortunately, but we can't account for some things. We don't know what, we know that the number of abortions increased this year. They're not legal, so it was a menace to the health of women, illegal abortion, but we don't know how many abortions were conducted. All the stress that these positive women are under, and some tragedies are tragedies, but when we think about Ebola and we think about Zika, this seems to be even worse tragedies. A couple of weeks ago, where I live, it's one of the main affected areas by dengue and also by Zika this year. A woman just died a couple of days ago. She had a heart attack. Her son was born with microcephaly and it wasn't diagnosed during her pregnancy. A couple of days after that, she died. And the worst of it, from our perspective, is this. As I mentioned, this is the poorest area in the country. And men, they were leaving their families behind, leaving their wives with their kids, and moving on to other cities, other places. And a lot of families, they were affected by this. There's this single story, and this is really the bad part of it, because these children, during their evolution for the first year, most of them, they start to have convulsion daily. And it's not easy to treat them. So these mothers, they need to be at home, be with their children. And these are very poor families, usually with 4, 5 kids at home. And the parents and the fathers, they were just leaving. So I think that this was the worst of it, increasing the economical burden for the families that were most affected by Zika at that point. Well, most of the information that I shared with you today was produced by the Minister of Health. I need to thank my colleague Wanderson from the MOH. And I feel that the actual impact of Zika is not out there yet. We're going to be seeing it throughout the next years. As these children, unfortunately, most of them, they're going to die. And other malformations that we still are going to be identifying in the next couple of years at least. Thank you.